Read this EKG. There are 4 abnormalities here. Can you identify them? This video is presented by Mapping CCS EKG for residents and interns, the best teaching material for EKG. EKG for residents and interns is an interactive PDF program that uses systematic step-by-step approach which will ensure covering all necessary aspects of EKG interpretation without missing anything. As a compliment, we offer you 10% discount coupon at the end of this video. You can use it when you purchase the program from our website. Back to the EKG. In our systematic step-by-step approach, we start with the rate. What is the heart rate in this EKG? We look at the rhythm strip. The rhythm strip looks regular because RR intervals are equal throughout the EKG, the blue arches here. We also notice that there are more P waves in this strip than the QRS complexes. For that reason, we will use the rule of 30 squares to count the heart rate. Now, in the 30 large box distance, I can count 4 QRS complexes and 11 B waves. So we have 2 different rates here, the atrial and the ventricular. Now the atrial rate equal to 11 times 10, that's 110 beats per minute, and that is fast. The ventricular rate equal to 4 times 10, that is 40 beats per minute, and that is slow. Next, we move to the rhythm. We also look at the rhythm strip, lead 2. So here we notice that B waves are of normal morphology, which is consistent with the sinus rhythm. We can also notice that there is no relationship between B waves and the QRS complexes. As a result, this is a 3rd degree AV block. Both B waves and the QRS complexes are regular, but there is no relationship between them. So we have a 3rd degree AV block. So how should we describe this rhythm? Now this rhythm is sinus, and because it's fast, we call it sinus tachycardia. And due to the absence of relationship between B waves and QRS, so it is sinus tachycardia with 3rd degree AV block. Now the origin of the ventricular beat is not coming from the sinus node because it is slower. It is slower than the sinus rhythm. So where is it coming from? It cannot be coming from the ventricles because QRS is narrow, so it must be coming from the junctional area. So I will describe this rhythm as sinus tachycardia with a 3rd degree AV block and a junctional escape rhythm. Next, the intervals. Okay, we look at BR interval, QRS, QT intervals. Now BR cannot be measured because there is no relationship between P waves and QRS complexes. QRS looks normal, narrow. QT, if we measure QT, it looks prolonged, but that is due to slow ventricular rate. And if we do the adjusted QT, the number looks normal. Next, the axis, QRS axis, we look at lead 1 and AVF, and the axis looks normal. Next, we evaluate the cardiac wall, atrial enlargement, ventricular hypertrophy, left and right, and there are no signs of abnormalities here. Next, we move to the ischemia. Also, we cover the septal, the anterior, the lateral and inferior. And there are no signs of ischemia. Now, infarction, Next, we do the same thing. We assess the possibility of infarction in all aspects of the cardiac leads. So, in the septal, anterior, lateral, all normal. But if we look here in the inferior, click here, we notice B waves in Q waves in lead 3. And there is also a small Q waves in AVF. Now, there are no Q waves in lead 2. This could be a normal pattern, but also it can be abnormal. So we interpret this as possible inferior infarction, age undetermined. So next, how should we write the report? The EKG report should consist of rhythm, QRS axis if abnormal, chamber hypertrophy or enlargement if present, bundle branch blocks if present, ischemia or infarction if present, and clinical diagnosis based on the above findings if present. And finally, abnormal or normal EKG. So for this EKG, the report will be as the following: sinus tachycardia with junctional escape rhythm and a third degree AV block, possible inferior infarction, age undetermined, abnormal EKG. Thank you.